Hello everyone. This is Otolaryngology Mnemonics and tutorials. So the length of intracranial and intratemporal segments, they are explained differently in different textbooks. So it has created a confusion in the minds of doctors, and the doctors were appearing for different sorts of specialty exams and as well as postgraduate exams and so on. So these are the commonly asked segments. The cisternal or the intracranial segment, for which there are four intratemporal segments, like segments that run inside the temporal bone. So we have different textbooks. The latest reference our column section. This is called round 8th edition, Cummings 7th. This is the latest and the standard updated evidence that is available to us. Shambaugh textbook, that is the 6th edition, that is a latest research for ear surgery, right? So cisternal or intracranial segment. This compound 8th mentions the intracranial segment as cisternal segment. So it is basically 24 millimeter length. It is 24. Similarly, Shambaugh 6th also mentions the length of intracranial segment to be 24 millimeter. However, Shambaugh mentions this length of the intracranial segment from pons to internal acoustic needles. However, the Cummings as well as Shambaugh, they mention the length of cisternal segment, that is from the cerebropontine cistern, CP cistern, to porus of internal acoustic needles. The CP cistern to porus of internal acoustic needles, it is 24 millimeter as mentioned. It's got round 8th edition. It's 15 to 17 millimeters as explained in Cummings 7th edition. So, as two of the standard textbook mention it to be 24, so the right size would be to go to 24 millimeters. As mentioned, as you can see that in the brackets, the chapters as well as the page number has also been mentioned for reference. So whenever you have some kind of doubt in like different kind of preparation materials for different exams are available, okay, so don't follow that blindly. Always check the primary resource or the primary standard latest evidence. Okay, now coming to the meatal segment. Meatal segment is also explained differently in different books. However, the consensus is among the Cummings 7th and Shambaugh 6th. Both mention it to be 8 millimeter to 10 millimeters in length. The labyrinthine, the shortest intratemporal segment. Similarly, Cummings and Shambaugh, both of it mentions to be 4 millimeters. Both of them mention it to be 4 millimeters in length. Similarly, tympanic segment. Tympanic segment is explained differently. Like Scott Brown mentions in chapter 112, page number 1386, it to be 8 millimeter to 11 millimeters. Okay, Cummings 7th, 11 millimeter. Shambaugh 6th, 13 millimeter. So the wise option will be go to 11 millimeter. Okay, so we'll take 11 millimeters because among all the highly accepted references that is available, the 11 millimeter holds the majority. Similarly, the mastoid segment or the vertical segment. So you can see it is explained differently. The Shambaugh 6th edition is quite out of proportion as compared to other. The Scott Brown 8th mentioned it to be 10 to 14 millimeters, whereas Cummings mentioned it to be 13 millimeter in length. Okay, since the 13 falls in this length, so probably and the safe choice should be equal to 13, right? So this is all about the different length of segments present in different textbooks. So next slide. Now how to remember? So we have a mnemonic to remember the most accepted or the majority consensus among all the textbooks, right? So you can see the intracranial segment is 24 millimeters, right? So how do we remember? Is that how many pairs of cranial nerve are there? There are 12 pairs of cranial nerves. So 12 into 2 equals 12 into 2 equals 24. So 24 millimeter is the length of intracranial part of facial nerve, right? After which you can just divide it by 3, then divide it by 2, and divided by 3, it becomes 8 millimeters. Divided by 2, it becomes 3, then 2, it becomes 4 millimeters. So 8 millimeters is it meatal segment, okay, that runs within the internal acoustic meters. 8 millimeter is the meatal segment. Similarly, 4 millimeters is the labyrinthine segment, okay. 4 millimeter is the labyrinthine segment. The shortest segment, shortest intratemporal segment, right? After which there 11 and 13 millimeter in length. Okay, the 11 millimeter is the horizontal of the tympanic segment. Horizontal of the tympanic segment, right? How do you remember this? The labyrinthine is 4. So what number is the facial nerve? The 7th cranial nerve. Oh, so 4 plus 7, that equals 11, right? After which we have the horizontal or the muscular segment. Horizontal or the vertical or the vertical or the muscular segment. Now how do you remember this? This is M. Okay, when you rotate this M, it becomes like 3. Okay, so it's already 11. Okay, you take 1 from above and it becomes 13. Okay, so it's the longest segment. The longest intertemporal segment is the masseter of the vertical segment of the facial nerve. So thank you.